Good afternoon, everybody. Welcome to the next episode of the podcast Digi4Care Project. My name is Szymon Jasinek and I'm your usual host. And today it's my very great pleasure to welcome Dr. Diana Iovanovici from Romania, and she's cardiologist. That's correct?
Yes.
So
Hello.
all of the data are correct, but I know that I didn't pronounce it correctly. It's Diana, not Diana, right?
Yes.
So in Romania, it's Diana. Diana, could you please, at the beginning, introduce yourself?
Hello, everyone, and welcome to Pilot 3. I'm a cardiologist. I'm a medical resident in Bucharest, and I've started my internship in 2021. And since then, I'm pretty passionate about cardiology. So I'm a cardiologist, and I'm doctor who wants to make a difference into people's life, not to live longer, but to live better.
Okay, it's a nice goal. Did you know from the beginning of your career or from your studies that you want to focus on cardiology?
I think yes. I think from my second year of medicine, I've started to have a love to cardiology, heart to heart.
That's nice. Basically, we can say that after the COVID-19, there is even bigger pandemonium or epidemic in the world, and it's the epidemic of the so-called civilization diseases. Among those diseases is cardiovascular diseases and diabetes as well. Can we describe why those two illnesses are so serious and so widely spread all around the world?
Yes, that's a very, very good observation. We're exploring something that sits right at the intersection of chronic illness and the cardiovascular disease are not just common because they are also deeply connected. Diabetes and heart disease share risk factors, and together they multiply the burden for patients, families, and even healthcare systems. And here's the thing, they are not abstract conditions, they affect you and me every single day. So in this pilot, we'll explore the human challenge of living with cardiovascular disease and diabetes. First, let's talk the living experience with these two diseases. Imagine...
We'll go there, but let's take a step behind. How can we describe, how do we know that somebody has a cardiovascular disease or diabetes? That take a look on the patient side. What are the alarms that are triggering that maybe you might be sick?
When you have a headache, like for example, or when you feel a bit dizzy, and then maybe you think you have or low blood sugar or you have hypertension, because this is very common. Anyone who has a dizziness or have a headache thinks that, oh my God, my blood sugar is very low, or oh my God, now I have hypertension. What is my blood pressure? So these are some kind of alarms.
What is unusual, or we thought it was unusual, that back maybe a decade or 2 decades ago, we thought that cardiovascular diseases are the diseases that are specific, especially for the older people, or older people than us, because we are both young, so 60 and more. But now it seems that this is also the disease that is very common also among people in their 20s, in their 30s, etc.
Okay, so the most common symptoms in older people, for example, are fatigue, edema, swollen ankles. That swollen ankles when your shoes feels uncomfortable, and that heavy chest. These are the most common symptoms.
Are there also any emotional symptoms of cardiovascular diseases, or we cannot describe the emotional sort of damage or emotional state?
Yes, of course. It's not just the physical part, it's the emotional part too, because you are fearing of collapsing in the middle of a gathering with your family, and you will feel depressed because of that.
And from the medical reason, not because of the family issues.
No, just for medical reason. Not family issues are something else. Yes, but when you're in danger to have a low blood sugar and you can collapse of that, when you're in danger of having heart attacks, when your analyses are not that good in good parameters, and you have to take medication every day, you have to take it on a regular basis and on a perfect hour. You can't delay it, so it's pretty depressive for the patients to go to the gatherings and enjoy as it would be.
So basically, the cardiovascular disease plus maybe sometimes diabetes plus high cholesterol is really influencing the life of every patient from the long perspective. How is it influencing, and what is the most challenging part of having those diseases, except of the diagnosis?
Yes, for the long term, poorly managed these diseases, cardiovascular and diabetes, lead to serious complications like stroke, heart attack, kidney failure, and even amputations in the case of diabetes. So outcomes that are life-changing, not just for the patient, but for the families and the entire communities. So you have to follow them. I don't know how
to follow the instructions of the doctors, for example, because
yes, to follow.
One of the challenges that doctors are facing is that the patient is not cooperating on their own treatment, and they are not following the treatment that was set up by the doctor. So you probably mean also this part.
Yes, it's very, very important to follow the exactly prescription, because if you have the pill, it doesn't work if you just let it in the bottle, you know. So it's very important for the patient to understand his disease or her disease, and to follow the exact advice from the doctor or nurse who is caring for him.
Near waiting, you're working as a cardiologist on the pilot 3 of this project, Digi4Care, and our goal is also to present the aim and implementing the digital solutions to monitor clinical parameters in the research as such. So let's move to this topic. Okay,
so one of the key challenges in rehabilitation after an acute coronary syndrome is a heart attack, in simpler terms. Is just how difficult it is for patients to actually make and sustain the lifestyle changes that doctors recommend, like I said. So that's why it's so important to provide structured support. Patients in rehabilitation need more than an advice. They need ongoing guidance, reminders, and feedback that fits into their daily lives. They need mobile applications and wearable device, and that's where we are coming in. These tools don't replace the doctors or nurses, but they act as a bridge.
So is it a tool how to help doctors and patients to treat patients better?
Yes, because
or more accurate, or more with more or better predictability.
Yes, because you know that there is a gap between the visits when a patient comes to me and I will prescribe him medication or a treatment, and after that he will come after 3 or 6 months or yearly. So is that gap that that influences his disease, because his symptoms changes daily, even hourly. So as a doctor, I should know that my patient has spikes on his blood pressure or has lower or higher blood sugar levels. So I think that with this project we can provide something that will help the patient to feel that someone is watching him every day, and for me to have an alert when my patient is not responding to my treatment. So that's where this pilot project comes in. It's being run across several European countries and focusing on patients recovering from serious cardiovascular disease events and those living with diabetes. And the goal is to test whether digital tools, wearables, apps, and guided support can fill that gap.
Can fill the gap between the first visit of the doctor and the second visit of the doctor after the heart attack?
Not necessarily. Even from the first to the second or after years.
So to be the patient with the cardiovascular disease plus with diabetes is monitored plus more or less on a non-stop basis, and the wearables are sending the data to some center or to doctor, or how does it work?
It's collected through an app which gathers it to a dashboard, because my patient will receive a wearable, a smartwatch or something like that delivers the information to an app, and the app gathers all the information into a dashboard, and after that we will
Examine the results,
yes.
Examine the results, and based on those results, what will you do with the patient who is wearing those wearables or using the app or having a phone or chest or something like that?
After we see the results that my patient has spikes on his blood pressure, for example, I will intervene with treatment, with more aggressive treatment, because it's clear that my initial treatment is not effective or not in the parameters, or the patient doesn't have the heart rate in range, for example. So I will come with something new. So this is very helpful for me on one part, and very helpful on a patient to feel better.
In this pilot project, you have divided patients into three groups. Could we describe what kind of group is it? What is their consistency, etc.?
Yes, we divided, like you said, into three groups. The standard care one, where patients get usual treatment like doctor appointments, prescriptions, lifestyle advice, nothing extra. The second group with a wearable and an app, but where these patients wear a device, something like a smartwatch, and use a connected app. And the device tracks his heart rate, his blood pressure, his sleep program, and physical activity. And data is collected continuously. And the third group, this is the most supported group. Here you have a wearable, an app, and clinical guidance. So
clinical guidance from the app, or from the doctor, or from both?
From both.
So basically, can we say that app is sort of a coach?
Yeah, you basically have a health coach backed in your pocket.
Your own personal coach in your pocket. It sounds good. And this project, can we say how many participants are being monitored?
Yes, it's around 100, but each group has about 20 to 30 patients per site.
Okay, and you are collecting those data, and how many months or how many weeks or how many, maybe even years, are you going to monitor them through the wearables in order to gather sufficient amount of information?
Well, for a project like this, for a feasibility study, because it's for now it's a feasibility study, we will follow the patients after 6 months. So I think that is pretty accurate data for this kind of project. Maybe after that we will rewrite the guidelines. But for now, for a feasibility study, it's enough to follow them for 6 months and just use 100 patients.
Let's take a look on the methodology and how this study works. Can we explain how the data is being collected and where are those data being stored and or sent?
Yes, the wearables, like I said, monitors the activity, the blood pressure, and so on. And the app, you install an app on your personal smartphone. And when you have that app, the app gathers it into dashboards, and moreover, for Group 3, clinicians regularly review this information and call them if they need.
Well, let's try to describe it on the day-to-day life. That, for example, my blood pressure is too high, or my sugar is too low. Then the doctor receives some notification, and the patient receives some notification?
The patient may receive a notification, but it's not that relevant for him to receive the notification. Maybe if he just forgotten to take his pills. But for me, I know...
So is there, for example, a reminder that you can personalize that I should take a pill?
Yes, this would be amazing, but I think that we're working on this thing on the app we are working with. So for now, you don't have push notifications, but we want to introduce them in the app.
But for example, if you are monitoring, let's say 10 or dozen patients, and you probably also have some online tool that you can see how the patients are doing, and if there is any notification, what's the next step from you? Did you call the patients?
Yes. The patients have regular calls from nurses or from the doctors. But when you have an alert, like I'm looking at the dashboard every single day, from all of my patients. So I'm seeing that user number 31 had over the 24 hours 3 spikes. Maybe he was active, and it's okay to have a little bit of more blood pressure. But if it was on night, like on 3 in the morning, I don't think that you are that active. And that should be a problem. That will ring me a bell to call my patient, to call him that he should come to a visit, and maybe I will do more investigations.
Basically, you're collecting the data from the wearable device plus app, wearable device plus app plus clinical guidance, and you're comparing the results of those 3 focus groups, right?
Yes.
How do you do that?
Well, I'm pretty interested to see if is any statistical difference between these 3 groups, and if it's relevant to give them and to introduce this technology into our systems, because it's pretty expensive for even Romania or any other countries to introduce something that is really new. Everybody is so skeptic, So I have to compare that it made the difference for my patient who had a wearable app and supportive clinical guidance.
And if we would have to explain to the listeners or the viewers how the clinical guidance is integrated in the group, what would be the answer?
Patients begin their rehabilitation plan. They will have a supervised program for 10 days, and after that they will have 30 minutes a day, 5 days a week for 3 months. And
30 minutes a day?
Yeah. Because, in my opinion, this is very important to explain and to understand that my patient to understand this is a risk factor if you're sedentary.
I fully understand that. The crucial question for every app and for every success of any app is if it is user-friendly. Are those apps really, because it is for young people, it is for everybody. Not everybody has the same mindset or the same skill set. So is this app user-friendly, and the patients who are about to use it or are already using it? So it is complicated, or is it really, really straightforward?
It depends, because not everyone I know that is a tech savvy. So I think that at first we have to understand it, and we doctors, yes, exactly. But for me, it is not that difficult. But I think that my patients, which are elderly, most of them, they are a bit reticent about the idea. But I think that if we introduce it step by step, and we explain them with how it works and how simple can it be, I think that our patients would be more receptive.
Let's move to the outcomes and the measures and what a successful pilot would look like. So, health-related quality of life, it has very shortcut, but I'm not going to pronounce it, which is measured by using the SF36 questionnaire. Please explain to us, first of all, what is SF36 questionnaire?
Yes, it's a questionnaire which looks like at physical functionality, vitality, pain, social roles, and mental health. In practical terms, it means patients feel better.
That's brilliant answer.
Yes. They are feeling more energy, less limitation in daily tasks, greater confidence in their health, and an improved sense of social and emotional balance. Like we said in the beginning, the symptoms are not the only part of the story. The social part is. So with this questionnaire, we evaluate that too. Here, success means seeing significant and sustainable improvements across most domains of this questionnaire, like physical function, ability to carry out daily roles, pain management, overall health perception, energy levels, and social participation and emotional well-being. So a statistically significant increase in this questionnaire is a success for us. And like positive patient feedback. When a patient comes to me and tells me like, I can walk more without feeling exhausted, that's amazing. And some other guy told me I feel more in control of my health. So it's pretty amazing to tell me to a patient tells me that.
So basically, based on the data and based on this questionnaire, you're able to evaluate if the patient is getting better based on data, but also based on the feeling, because the feeling in psychology and in medicine is extremely important.
Yes, it's very important.
And the well-being as well. You have also mentioned that people might have a tendency to be, I'm not criticizing, but conservative and a little bit laid back about the new technology being used in medicine. Do you think that this statement or this attitude of people towards the new technologies, telemedicine, etc., is changing throughout the time?
Yes, I think so. That's why we have two more questionnaires, the SAS and the TEM. The SAS is the system usability scale. So we are looking for a response from the patient regarding usability of this technology. And the big question is here is that do patients actually use the tech? Is it simple, intuitive, and integrated into daily life? Even the most advanced wearable devices is useless if patients don't really use it. So, or if the app feels confusing. So here, success means that the device and the apps are easy to use, intuitive, and well integrated into daily routines.
Do you explore how the digital monitoring could be scaled across long-term care facilities, especially in the future, but maybe also in these days? Already yes. In these days.
In these days, they are using something like this in Portugal, but I think for example, in Romania, it's a bit hard because we don't use only one system. It's a local system between the hospitals.
What kind of system are we talking about?
The medical system.
Okay, the medical system.
Yes, the medical system, just exactly to protect the patient's data. But maybe in the future, in long term, if we succeed with this project, maybe we can make sure that all the hospitals, like in Romania, will use only one system. Yes, exactly. And with that, maybe we can introduce more technology in this in Romania.
Basically, all Europe, and we can say all the Western civilization is facing basically the same problem, and that is the lack of doctors and lack of the nurses. And based on everything what you said, Diana, my impression is this could be also the technology replied towards this problem. That with the wearables, with the smart technologies, maybe with the help of the AI, we can fight with this problem more successfully.
Exactly. We transform from a reactive healthcare model where we wait for people get sick to a proactive model. So where continuous monitoring allows us to step in earlier and personalize
Stepping
care.
earlier would mean to step in even before the cardiovascular or the diabetes arise.
Yes.
So the potential is that maybe people could wear those wearables and not even get these diseases.
Exactly, because...
How far are we from it, in general?
In general, I think younger people are having this opening to the technology, but like I said, after 60 years, maybe not really. But
yeah, we take
yes.
Look. You have a smartwatch. I have the conservative one.
And yes, he told me that I have to stand up and move for a minute.
Yes.
I have a push notification.
Mine is not telling me anything, just the time. It's a very nice watch. So those are the potential benefits that will be shaping also the broader discussion about the medicine and the healthcare. What would be the challenge that it is maybe taking us back or not making us to progress as fast maybe as the technology allows us to do?
Maybe, yes, because technology is moving very, very, very fast. And for many of us, it's very hard to keep on because each one of us has a job, and my job, for example, doesn't require so many technology, at least for now. So it's hard even for me to keep up with all the technology coming from backwards to me. So yes, it can keep us a bit behind.
I'm a big fan of the technology, etc., etc. But what I'm worried about, or basically what people are worried about, is who owns the data and who sees our data, because we do not have anything more sensitive than our data about our heart, about our diabetes, or about any other data that is related to our well-being. So who sees these data and how are they protected?
Usually, all the data is packed in a cloud. The cloud is on a server in Europe. That's what we want to believe, I think.
In Europe or in Europe? And at least, you know what I mean, Western Europe or the Central Europe, not Eastern, very, very Eastern Europe.
No, not very Eastern Europe, in Western Europe, yes. And there are all the data, but with not a name precisely.
So they are anonymized?
Yes, they are anonymized, pseudo-anonymized. Because I know that my patient called Maria or Jon or whatever has user 1, 2 and so on.
Because you need to call them somehow.
Yes, because I have to follow them, because I don't know if I see on a dashboard user 3 had 3 spikes of his blood pressure.
It would be not very nice with user 3, you have a heart problem, do something with
Exactly. And that's why I know that the user 3 is Maria, but the data and the cloud in Europe is not allowed to see his precise personal data. It might be stocked his date of birth, but many people, I think, are born on exactly the birth time. So I think that yes, data protection is very, very important. But when you have just numbers and not a name to associate it, I think it's pretty safe to say.
Diana, thank you so much for attending, and thank you for listening or taking a look on us. Thank you. My name is Shimon Esnek.
Thank you, and see you next time.